clerk read the next bill.
Senate Bill 8 relating to prescription drugs.
Question now arises upon third reading and final passage of Senate Bill 8. Representative Keny-Guyer.
Thank you, Mr. Speaker. The House Healthcare Committee, along with the Senate Healthcare Committee and the Senate, full Senate, passed this bill unanimously. The background on this is that the Oregon nurse practitioners provide primary and specialty care with full prescribing authority, but have restrictions on their ability to dispense prescription medications. Senate Bill 8 removes restrictions on nurse practitioner dispensing that serve as a barrier to providers and their patients. Under the current law, a nurse practitioner with prescriptive authority who wishes to hold dispensing authority must submit an application to the Oregon State Board of Nursing, OSBN. Current statute requires that the applicant demonstrate a lack of readily available access to pharmacy services and show that a grant of dispensing authority would correct this lack of access. As part of this application process, the nurse practitioner must complete a dispensing program jointly developed by the OSBN and the Board of Pharmacy. When a nurse practitioner applies for dispensing authority, the OSBN is required to notify the Board of Pharmacy and issues a second notification to the Board of Pharmacy if and when the application is approved. A nurse practitioner does not need dispensing authority to distribute prepackaged sample medications. Additionally, if the OSBN receives a complaint about a nurse practitioner relating to dispensing, the OSBN must again notify the Board of Pharmacy, which then has the ability to do an inspection. SB 8 does not change the involvement of the Board of Pharmacy. Nurse practitioners have had limited dispensing privileges for a long time. In the past 3 years, there have been no complaints against nurse practitioners related to dispensing. Currently, medications dispensed by nurse practitioners must be prepackaged by a pharmacy or manufactured, registered with the Board of Pharmacy. SB 8 would not change that requirement. SB 8 ensures that nurse practitioners, whether in Portland or Prineville, have the same ability to dispense medications to meet the needs of their patients. So basically, our rural providers, nurse practitioners, have had this ability. There have been no complaints on it. Right now, we would like everyone to have that ability because even if there's a pharmacy, a Walgreens in a urban area, often it's really hard for someone to have to go maybe toddling their kids along and have to go to another pharmacy. They might have barriers in transportation. And because we know that this is well within their scope of practice, they're trained for it, and they're regulated for it, we would like to remove this barrier. I urge your support.